Welcome. Thank you so much for being here with me. I have today Ruchit Nagar and Mohammed Shahnawaz from India. You all met Priti Venkat, who was one of the starting team members of Cushy Baby that got started right out of a class here at Yale. Ruchit is the founder. He was a Yale College student at the time and then did his master's in public health and is now a medical student at another university, which we won't name. So I want to pick back up on the conversation that I was having with Priti when she came to visit my class. And we were talking about moving beyond the object. So obviously, it was a huge innovation to design this necklace that was very much in alignment and very integrated into the local culture, and the women embraced it, the families embraced it, and it allowed they loved wearing it, and it allowed for a way to collect digital information on a child's immunization and other aspects of maternal child health. But then moving beyond the object, how do you deal with the healthcare system in India in order for this to be something that's going to sustain and scale, right? Beyond just that one pilot. So Ruchit, tell us a little bit more, how because if you don't do that, you're not going to grow outside just like a student venture, right?
Right.
So how did you manage that from inside the classroom?
Yeah, so it's a really good question. There was a specific moment in 2015 when we won a grant from UNICEF where we realized that we had to not just be a research project at a university, but we really had to think of ourselves more as social entrepreneurs. And we at the time were working with an NGO in a pilot on a pilot basis, as you mentioned. And we realized that long term, that probably wouldn't be sustainable because the NGO didn't have the funds to continue to support the system. They were really giving us a platform to try things out, which we were very thankful for. So at that point, we realized, okay, who is the actual player that is giving most of rural healthcare the services that they need? And that would be the government. The government is giving healthcare services to over 80% of India when it comes to maternal and child health. And they're in the same, district, same location that we're at. So we just went to them and we talked to them and we said, we have this application. We track immunizations at the time. And then Shanawaz, do you want to
Yeah,
tell us what happened when we told?
Well, Shanavaz, first, how did you get
Yeah,
involved with
yeah,
the student team? How
right,
did you connect?
right. So,
You're
so
the COO today, and you're the
yes,
CEO.
yes. So I'm also having a public health background. In year 2014, Ruchit wrote tens of mail to different institutes, and I was lucky one to responded to his mail.
So you reached out
Um,
to the Public Health Institute where you were studying.
right,
right.
right. So my professor connected me with him,
Interesting.
and just the year the Khushibi was founded at Yale, and at that time I was pursuing my doctoral.
Okay.
So for the next 2 years, I was doing this as a side project, and I was the
While
PI
doing your
while
PhD.
doing my PhD. But there was a time when I had to make a decision, and then I did the trade-off, and I thought that this is a project which can be a real change agent, and it caught my imagination. So I left my full-time doctoral, and then I joined Khushi Baby full-time
Oh, wow.
in year 2016 for the project that we were actually doing the trial with the government.
Okay.
So working with the government was really, challenging for us. Getting that project and then planning, implementation, logistics, everything. So year 2016, we initiated our second trial with a cohort of 3,200 women in Udaipur district. And we are looking forward to develop Udaipur as a model district. So we are working like in 5 blocks of Udaipur district right now
But who's
in
going to pay
400
for this?
villages.
I mean, one thing I struggle with all the time is this tension between, and that's the tension of social entrepreneurship. Are you going to just start your own business and get the work done? Or are you going to try to strengthen the existing health system?
Right.
And the advantage of starting your own business is that it's something self-sustaining. And if you work with the government, obviously it's the best way to scale and reach everyone that the government's trying to reach.
Yeah.
But the government's not going to pay for this.
Exactly.
Yeah.
So the government hasn't paid for this, and we're with you on that. I think for us, if you follow our arc, we started as a student project. We
Mhm.
turned into a research project. We had these trials that were going on, and we were still learning. We were still getting to know, who are these mothers in rural India, who are the nurses that deliver care to them, who are the health officials that supervise the nurses, how does the system even work, and where does our necklace, which was the core idea, fit in. And there was a lot of work that went into that. So we eventually found out that we have to build out more than just a necklace. We have to build a real platform that can really serve the function of each of these members' jobs. So not just the health worker, but also the health official. But even then, it's not something that they would necessarily pay for because everyone knows that it's a pilot. We're not collecting all the data for the district. So even the data that we do collect is difficult for them to use. And the customer, like you said, even when you do get the customer on board, it takes years to even build the initial partnership and then years to get the funding. So it's really, we have one big customer, which is the state of Rajasthan that we are targeting, but the path to getting there is very difficult. And at each step to get there, we have to prove our value. So that's the reason why we've emphasized the research aspect of it, is that we have to actually do randomized trials, prove that we're improving immunization rates, prove that we're improving health outcomes, prove that we're improving data quality outcomes, so that way when people question us, we can have something to really back it up. But besides that, I think the other thing is learning from this experience has also allowed us to think about new ways to apply the same core technology in a manner that will appeal to the entire pyramid instead of just the bottom of the pyramid. So now that we have a work experience of using this technology, which is the near field communication technology, we can go beyond maternal child health use cases and make it really more of a universal health card that can be, sold to hospitals, hospital chains, that can also be made as part of smart city initiatives in India. So those are the things that we're now capable of doing after gaining all this experience working in the hardest conditions at the last mile.
So this is a similar conversation that I was having in the previous segment with Mocha Lantam, who created a platform also for managing data for health delivery in Kenya. And he initially was thinking that the government would be his customer, and then realized that maybe one day they will be, but he can't sit around and wait for that to happen because it takes a really long time, and he didn't want to just be applying for grants and charity. So he realized, I have a commercializable product. There are many players in the health system other than the government. So how can I engage with them in hopes that one day the government would also adopt this? Because I think that proving that this works is not enough. I mean, there's a lot of evidence that a lot of things work, but the government still doesn't pay for it. So how do you feel about, if you start looking at other customers other than the government, are you running the risk that you're going to have some kind of mission drift, or that your products and services will change so that they're no longer reaching the base of the pyramid? That's what usually happens, right? What do you think?
That's a really good question. In fact, I mean, right now we are working with government in 375 villages.
Whoa.
And it covers almost half of the district where we are currently working. So the question is, the government with which we are working is they are already having one system called Pregnant Women Child Tracking System, but that is something we are having a multiple differentiator. I mean, that is actually adding value to the current system. So this current system is completely paper based. I mean, we are focusing on quality.
Okay.
So we are very much in sync with the state level officials.
Mm-hmm.
We are updating them regularly, engaging them regularly. In fact, our deputy director is here for the talk later today. So that whatever work that we are doing should not be a parallel to the existing work. It should be in sync with the. So that's why we are hoping high that it will be integrated to the current system in coming time, with the kind of quality of data, the kind of the level of granularity that is there with our data, and the action we are taking on those data.
You
That's very
definitely have
important.
to be in it for the long haul.
Yeah, of course.
And I mean, we didn't realize this initially, but just like we need engineers on the team, we also need people who are policy managers and who can sit with government officials. And it is a hard path to take. It's not going to be easy to get a big government customer, but there have been examples of outsiders who have done it. So you can look at Medic Mobile, Last Mile Health, Dimagi. Some of them are nonprofits, some of them are for-profits, and they've been able to sell, data collection technology, digital data collection technology, and partner with ministries of health. I think one of the key aspects of this, in this particular path, is that we really need to have strong partners, which is something that we've done from the very beginning. So we were very fortunate to get grants from UNICEF and Gavi, which opens us up to a lot of ministries of health right away, as well as different innovation centers that they run. Also, Johnson and Johnson in the same regard. In addition to that, we've tried to find technology partners. So there's a company, IDEMIA, who is behind the Aadhaar biometric social security registration for 1 billion people in India, and they work closely with the government. So we're definitely trying to work with partners that have a proven record of selling to the government in the past. But that being said, going back to your question of, is that going to detract us from the initial goal if we, let's say we make the universal health card, what about the Cushy Baby system for maternal and child health? Will that go away? Will we be distracted? My hope is that that's not the case. I think that there should be a way for us to make a perhaps whole pyramid model that is sustainable, that can help drive the bottom of the pyramid maternal child health work that we're doing until a bigger player decides to adopt it and scale it up. That balance will, however, be tricky, and it's something that we'll have to learn as we move forward in this process.
Okay, so a few key takeaways. So many reasons I'm glad you're here. One is because I think it's so important for us to see examples of things that actually worked, like the examples you just shared, and hopefully you also. And the second is that I love what you mentioned about it's important to have engineers, healthcare people, medical doctors and public health people and policy people if you're really going to engage all these stakeholders. And that's something that we always deal with inside my classroom, where we have students from the School of Management, students from the School of Public Health, Divinity, Forestry, undergrad, Global Affairs, and everyone's thinking about if we're going to reach the Sustainable Development Goals, we have to break the silos that we're operating in. We almost have to leave. It's a balance between not letting our academic disciplines be baggage that don't let us to talk to each other, but also what can we each bring to the table, because all these competencies are needed. Otherwise, we'll never make it. So thank you so much. We're going to head straight to the classroom now. Thank you for joining us today.
Thank you so much.
Thank you, Matt. Thank you very much for having me.